everyone. It's been a long, long day for Team ASCA right now. We're just winding up for tonight. We thought we might just dwell on one of the most important things. We talked about so many important topics that are, some of them are Australia specific, but a topic like today is an international topic that every person who's living with sickle cell disease or anyone in the sickle cell space should be able to think about in terms of how the public or how other organizations like the World Health Organization view or perceive sickle cell disease, and what rights do these people impacted by sickle cell disease have. We have Sam Bunya, who's been part of our team. We've got another team which is Amplify Sickle Cell Voices, and we've discussed this topic before. We also have Ginger Davis, who's supposed to join us. I hope she hasn't forgotten, because this is 7:36 a.m. in New York where she is. Hopefully she does. Do we have anyone here who can try to contact her? Yes, so yes, maybe Isabella, you can contact Ginger and see whether she hasn't forgotten. But the discussion still goes on. I have a few people who are very conversant on the history of sickle cell disease. If you are happy to contribute to this topic, please raise your hand and join the panel. Natalie, do you want to join the panel? And then we can continue, because the discussion can continue. Dr. Fasipe, if anybody wants to join, please raise your hand. We want to keep the fire going. It has been a very good day today, and sometimes it's a very early morning, and Ginger is a warrior. Warriors are unpredictable. So I have Natalie, who's joined the panel too, and welcome, Natalie. So the discussion today is the World Health Organization strategic plan. Where are we today? And for this one, we've discussed this topic today. Ever since World Sickle Cell Day was recognized, sometime I think it's 2010. I'm not presenting today. I'm supposed to moderate, but I'll look up the days and the dates. Sam, I'll give you the floor to just give us an introduction of why this topic is very important, and I'll look at the dates as you speak. So welcome, Sam. Thank you so much for joining.
Thank you. I guess I think the main thing that we would like to look forward to is to have a conversation on strategic plan for sickle cell disease in general. And has that been implemented? That's one question. And then also at the same time, what has been done so far in regards to some of the strategic interventions that have been done within the respective countries? And is there any discussion in regards to what would be the way forward to have the actual strategic plan that was discussed sometime in 2010, as you've mentioned, and then seeing how best to have a way forward on the same. I think one of the things that has to be looked into is, of course, as a whole, the WHO have a mandate to ensure that disease areas are also taken care of in terms of providing public health interventions, reducing the burden for sickle cell disease through the respective regional leadership. Like, for example, you have WHO Africa, you have WHO Europe, and also having stakeholders who may be able to contribute in reducing the sickle cell disease prevalence, morbidity and mortality. And how best are they working together with either non-governmental organizations, government institutions, the ministries of health in various countries, and how best are they also having a way forward in regards to healthcare provision. So it's still an area of interest to have the WHO and also the United Nations convention in terms of having the United Nations Security Council, basically, to have a way forward for sickle cell disease as well. Because it has been a discussion in terms of this UN resolution in 2010, but we are around 11 or 12 years just past this resolution, but we haven't yet felt the impact that we deserve, so to speak. And the sickle cell community also deserves. But are we being served, or are we having an injustice towards ensuring that some of these strategies are actually implemented, or whose role is it to ensure that some of these interventions are put in place in terms of policies as well, put in place, as much as the sickle cell advocacy community are pushing these agendas to their respective countries through their organizations. So I think it's more like having a way forward in terms of how best do we strategize pushing the agendas in a, is it an NGO perspective? Is it a governmental perspective? And who are the key stakeholders and the players to push the agendas in various capacities? So probably, the conversation would be around who would be, what are the roles? Whose role is it to do what? And also at the same time, how do we ensure that these strategies have been implemented? Because I think one of the key areas, of course, is to look at prevention and control, and also reducing the burden, as mentioned, and also looking at how best to have strategies set within a healthcare perspective in terms of effective clinical laboratory diagnosis, imaging facilities, newborn screening initiatives, research as well, establishing patient support groups and the like. So, I mean, it's still a role to, in terms of who would be the key players and stakeholders to push these particular agendas forward. I don't want to dwell so much on the nitty-gritties of who has done what, but also at the same time, who are the key players, what roles do we have, and is the WHO doing enough to be able to implement as an international body, like the way they push the agendas through the malaria perspectives and also other perspectives. So that's how I would put it at the moment. Maybe if Natalie can add a few pointers on that.
Hi, Sam. Hi, everyone. Yeah, I mean, to what you've basically said what we've been talking about all the time. With today's first conference, I personally am really happy with how it's gone and all that we've heard. The science is moving in the right direction, but I think what we definitely need is also that pull, the more global strategic plan, which can actually help the people that really need to benefit from all of these advances. And as we know, it's all of those people are really, I mean, at least one big majority of those people is in Africa, some are in India. So it would really be good if we can, as I always say, hold, policymakers' feet to the fire to get ourselves moving in the right direction. Yeah. Thank you.
Yeah,
thank you so much, Natalie. Looking at what Sam was just talked about in terms of there's different regions, and I think all of us on this panel, especially at this time of the night and this time of the day in different parts of the world, we see that most of our counterparts in Africa and other regions have joined us. We are passionate about Africa and the strategic plan that was done in 2010 in terms of the African region. So looking at what occurred, so on the 22nd of June 2010, the African region of the World Health Organization signed a strategic plan for sickle cell disease. And as Sam has said rightly, the main areas were to develop national strengthening policies across sickle cell disease management, You know, they had to have early identification and management and community awareness. All that was in 2010, and they signed a 10-year plan. In that plan, by the year 2020, we, according to the plan, they wanted to have at least 50% of the 23 member states to have implemented a clear design national sickle cell disease control program. 25% of the countries of the African region should have adopted the concept of a comprehensive healthcare management of sickle cell disease. And at least 50% of all the sickle cell trait countries will have established a sickle cell surveillance system with adequately trained staff. That was 10 years ago. And looking at what has occurred in the past 10 years, I would say, I think in the recent years, a lot of this has come up. A lot of momentum has come up in terms of managing sickle cell disease globally. But with the focus in Africa, we've seen that organizations like the Hematology Society of American Hematology Society and partnering with different countries where we are setting up like things like newborn screening. We are setting up registries in some places. We have guidelines in most places. Just Zambia's guidelines were implemented in 2019. Kenya was sometime this year. And we see that other countries are also going through the same. Would you agree, Sam, that I think they are trying, despite having less resources, but more can be done? Would that be a very good observation or conclusion, you reckon?
I think I can say we are trying, or our governments are trying, advocates are trying, but not really the WHO per se as an international body. You know, as mentioned, they have the mandate as well to push agendas and to push the sickle cell disease community forward, just like any other disease area. But you know, their focus is still changed, or is still focused on other disease areas. But let alone that, there is a lot of people who have come up now, like philanthropists, the Gates Foundation, Clinton Health Access Initiative. They have also taken you know, those roles as well, pushing the agendas of specific disease areas, either rare disease areas, etc. But I mean, it's still. I can say that the fact that the discussions were done in 2010 and strategic plans were put in place, or rather having a resolution in place to have a way forward, is still something that is yet to be explored a little bit more in various regions, and reaching out to as many as possible. So I can say other players, key players or stakeholders have taken those roles, other than the WHO as they are mandated to. And I think over the years, WHO really hasn't stepped up to the plate to focus on specific disease areas. But now they're looking at specific things that they feel that would be, you know, like a big area of interest or concern, like the COVID-19, like pandemics basically, or epidemics that would come out. WHO are taking those roles. But in general, we still have a critical standpoint as you know, other organizations and other pharmaceutical companies, willing partners who are able to still push those specific strategic plans or discussions that were made to have a way forward for sickle cell disease in general.
That's right. That's right. And I just want to confirm and attest to the fact that we tried to invite the representatives of the World Health Organizations here in Australia, and we still haven't heard back from the initial promise that they did. So maybe later on in future, we'll bring them on to discuss this important topic. I'll open it to the floor now. I've got Dr. Titilope Fasipe, who's, you know, as African as we are all on this panel. She is African born, raised in the US, but I believe, you know, her heart is also in Africa, like most of us on this panel. Dr. Fasipe, what do you have to say about this topic? Do you think the World Health Organization is doing enough, and the member countries? What's the collaboration there? What's missing? Thank you, Dr. Fasipe.
Hello, morning. Well, good day. I keep on saying good morning. Good day. You know, this is a question that I have wondered and pondered for some time now. I agree with everything that Sam was saying. And one of the things I wanted to ask Sam to elaborate on even further was that accountability piece. I think there's the strategy component, and then there's how do we keep ourselves accountable to that strategy. And when the strategy is, when some parts of the strategy need to be revised, when do we give feedback? Like when do we communicate what is working and what is not working? From my limited understanding is that WHO is this big network, big umbrella, and sickle cell disease falls under the non-communicable diseases component. And historically, that component has not been given the most resources because, of course, communicable diseases usually got most of the resources. So now that we're in an age where WHO says, yes, we want to put sickle cell disease as a priority, I think for many of us that have been waiting for so long, it's hard not to see, you know, we always want fast action. I think it's important to be strategic, but I think maybe the communication needs to be opened more so that we understand the process better. So I don't know if Sam can respond to that or somebody else about where they think some of that accountability to the strategy lies.
I mean, I'll try to answer that question. I think accountability has always been in every organization and even any workplace, even in your own homes, who is held responsible or accountable for any actions, whether be good or bad. And I think on a WHO perspective, as mentioned, if NCD is still placed under chronic diseases, and it's a wide spectrum of disease areas to look into. How do you prioritize which disease area first? And also in general as well, in terms of receiving any funding from any international body, and I'm sure with WHO, they receive funds from the United Nations, if I'm not wrong. And they have a key, or rather the member states through the United Nations have a key role to how these funds will be allocated and used. And yeah, it becomes a bit tricky because they are supposed to be independent, be able to support member states independently, just like the World Bank or any other, or IMF, like any other organization. And who is held accountable or responsible is the WHO, the United Nations, the people who support that specific interest in terms of, you know, giving them the opportunity to support, you know, the initiatives that they have. So I think it's more of it's a little bit political as well. Looking at, you know, who are the people who are funding or supporting WHO. And I think looking at how things have been over the years, that's why we're looking at other organizations, pharmaceuticals, taking ownership of some of these disease areas. Of course, there is a market for making money. There is philanthropists who have so much money, they don't know what to do with it. They want to have a way to make a name for it or for themselves, but also at the same time making an impact in the communities. And I think it's just about time for sickle cell to be seen and heard. And the noises have been so much greater and much, much louder. There's more evidence that now sickle cell is being brought to the forefront. I mean, it's definitely evident for Africa based on some of these initiatives which are being seen through various organizations. Novartis are coming in very strong. I'm sure, Gates Foundation and Clinton Health, Access Initiative, they're gonna be following suit anyway. Some of these projects which are interrelated or interlinked, like malaria projects sometimes are also linked to sickle cell projects in the research space. So I think it's more of the WHO are not really doing their bit, but now other people are taking over. And I think it depends on how you want to look at it. Do we go back to the WHO and have a conversation with them again and say that, your role now has been taken over by other stakeholders, and what is your role now? And would you wish to continue with that role? Because if some WHO representatives or people within their respective regions are not sort of like complying or adding value to specific disease areas, let alone sickle cell disease that has been, widely spoken about, and bringing them to book or making them accountable, it still poses a question on their role. And how best do we say, okay, I don't think WHO is doing enough. They are just focusing on pandemics, epidemics, things that are coming out on a global perspective, and leaving other stakeholders to clear the roles for specific disease areas.
That's right, Mr. Mbunya. Dr. Fasipe, do you have anything to add to that before I get anyone to add on to the topic?
No, please. I was watching the time too, so I didn't want to be the only one. So yes, I appreciated Sam's response to that.
Thank you. I promoted, I know there are passionate people on this panel. Natalie, do you have something to say before we can ask maybe KW to say something?
No, I don't have anything to add right now. I'm actually running to another session. Ginger will possibly be joining in a few minutes. I actually got her the link. So nice to see everyone.
Yeah, almost finishing, but she can join. It's okay. KW, do you have anything to add on this very important topic?
Greetings. Are you hearing me, everyone?
Yes, please.
Great. Okay. Good morning from my side of the world. Good night to you all. The involvement of WHO is a very wide topic. Fortunately, I worked in an organization that benefited from their funding many years ago. That said, I feel that what is transcending now in terms of technology, and I want to be specific about Africa and the young professionals who are driving tech. One example of this, which is not related specifically to sickle cell disease, is where funders initially would tell program managers in their rural areas especially that it's difficult to manage funds from the funding agencies directly to the recipients. For example, people who are living in rural areas of any countries of Africa, probably anywhere throughout the world. And what tech young people in Africa have been able to do, have been able to create something called a wallet, and funders can now directly deposit their income into those wallets. So that money is going directly from the fund and bypassing the middle persons and getting directly to those who need it. How can sickle cell disease benefit? So I've said on a couple of platforms that I have something called the COVID will, and I know it's something that we may frown on, but what I'm attracted to is how much the entire world, all regions, all continents have changed in less than 2 years. As a matter of fact, in 3 months, various protocols put into place to change how we interact, to ensure that this pandemic, as we describe it, doesn't spread aggressively. It means, therefore, that there's the ability to do this. So the question is, how can we get consistent protocols in place for sickle cell disease? I've heard over the last 5 years how it can't be done. COVID has shown us how it can be done. So we have two things working for us. We've seen where the global will is in place, or the global ability, I would say, is in place. How can that be transferred into will? And how can we use existing expertise, especially in the young, and more specifically in the Africa, to get these programs up and running? Funding is just one example, but you can get there's a very healthy example in Liberia with community health workers. They're the ones who got trained, went into the communities, and able to take care of Ebola. I'm saying this very superficially, so I don't have to go into a whole lot of details. So my point is that with the observation that we have been made this morning, that the work that is expected from these global organizations, health organizations, not being as clinical as it should be, there are opportunities. And we now have three prongs. We have the COVID well, if we can bottle that and create an approach. We have technology that's coming out of Africa. I'm just saying Africa very generally, because there are 54 different countries. I can't remember the countries that the examples that I identified exist. And I won't say to that point, but there are three key starting points now. And then there's fora like this, where we can now communicate so easily and have information shared, so people can have many more options than you had before. So my question to the panel this morning is, if these are relevant options, what is our next step? Because we've been looking at the organizations, the governments, the funders, but these examples have shown how it can come into the communities and get executed. As I mentioned, Liberia and Ebola. Of course, the skills were given to the community health workers, but they are the ones who executed the work and gotten those communities back on track. Technology to facilitate transfer of funds, just one example. We can transfer information, we can get into the communities en masse, teaching people how to do things as well. How can we use these tools to achieve the same goals that we are asking all these global organizations to do?
Yeah, Agnes, I think I can add on that before we wrap up. Yeah, I think KW has really touched up on the main thing, and I've just thought about it. Funding, capacity building. Does WHO have the capacity to support chronic diseases alone? And can they work alone? And also looking at the fact that I've mentioned that WHO over the years have been focusing on pandemics or epidemics, then the other disease areas are not really thought of or being taken care of. And that's the reason why other organizations are pushing their agendas, so to speak, because there's money involved. So it depends on how you look at it, but the question would be, or the way forward would be, is WHO really an organization that would be still able to continue their agendas to support chronic diseases, since sickle cell disease is part of chronic diseases in their strategic plan. And chronic diseases are so many. As I mentioned, they still have a hierarchy of how they would support certain disease areas. And as mentioned, funding still comes from member states who are funded from the United Nations, and WHO is still is a recognized body of the United Nations. So there's many other problems, so to speak, that the United Nations are also focusing on, like Afghanistan and the like, refugees, etc., and leaving other important areas of interest. And still, we still need to continue advocating for WHO, but also at the same time, look at other avenues for funding and supporting sickle cell disease initiatives, especially philanthropists, pharmaceutical companies and organizations alike, who are still, who are able to support initiatives for sickle cell, but also at the same time, being able to channel these funds, as KW has mentioned, to the respective regions and respective areas effectively, and be able to make an impact.
Definitely. Well said, Sam. Well said and well summarized. It's been a very, very good discussion. And again, I'm so glad that we do record this discussion so that we can go back and review and ask ourselves, like, what are these organizations that are supposed to look out for anyone impacted by conditions like sickle cell disease doing to do their job? Yes, I like the notion for KW in terms of the COVID world. It took 24 months and look where we are. We are having vaccines, we're having boosts for vaccines in other parts of the world, when other parts of the world like Africa, the vaccines are not even available for any lay person. We have sessions, 2 at the moment starting in, and another one supposed to come in this meeting. So unfortunately,
I have a quick question, Agnes, before we leave. Can we? I have a quick question before we leave.
1 minute, KW, because we need to start the other session in this second.
I need 30 seconds. As far as I know, sickle cell disease contributes to a whole range of NCDs, non-communicable diseases. Can we now add to our conversation that if sickle cell can contribute to, for example, heart disease or heart disorder, because I have a friend who just had a heart operation here in Trinidad and Tobago, would that be a way of opening the doors to other funders who have those as a focus?
That's a question we can pose to ourselves, and let's put that on the agenda on the next Amplify Sickle Cell Voices, because we have 2 weeks before we finish the series. There's always room after that. No one stops us to add another one, and even during the week. So thank you, everyone. This was very informative, like always, and we'll continue having this discussion. So for now, I think we have Portuguese and French sessions. Please look on the agenda and join us there. Thank you so much, everyone. Have a good day. Good night.